Hi everyone. So, it doesn't seem like I'm having much luck when recording these musculoskeletal videos. Just seem to be getting the injuries that I'm talking about. Just let me readjust myself here. Welcome back to my channel. I hope you've had an amazing week. This is GP Made Easy, and I'm Dr. Daniel Follows, a fully qualified GP in the UK. So, today I'm going to be talking about sciatica, as it is a very common condition and it can be quite disabling to patients. But before I do, don't forget to like, comment and subscribe so I know that you're enjoying this content. But anyway, let's get on with the video. So first of all, a little bit of background information. So sciatica is classified as radiating leg pain caused by inflammation or compression of the lumbosacral nerves. So as you can see up in the diagram, it's compression of any of the nerves from L4 to S1 that make up what's called the sciatic nerve. And that's a nerve that goes all the way down your leg and innervates the whole of your leg. It affects about 13 to 40% of the population. And again, unfortunately, it's more common in women and men, and it is more common with increasing age. So moving on to some of the causes. So the commonest cause is a herniated disc, and this is the disc in between the bones of your spine, which is called the vertebrae, and this can sometimes herniate backwards, as you can see in the diagram, which can then cause compression of the nerves. Another cause is what's called spondylolisthesis, and again in the diagram, as you can see, it's where some of the vertebrae have slipped out of their normal alignment, and it commonly can go backwards, causing compression of the nerves. Another cause is spinal stenosis, and what characterises this is that patients find the pain worse on extension of their spine, but find it better when they flex their spine. Another cause is lateral recess stenosis and foraminal stenosis. So as you can see, there's a little bit of narrowing where the nerves leave the spine, which irritates the nerve and causes the sciatica symptoms. And another cause is central spinal stenosis, and this is characterised by spinal claudication, which is either bilateral calf pain or paresthesia, which is tingling sensation, or it can feel numb in the legs on walking. Risk factors for sciatica include smoking, obesity, certain occupations, and your general health status. Now, moving on to how sciatica might present. So patients tend to present with lower back pain that radiates down one leg, and the pain tends to radiate down the back of the leg. So they'll say it starts in my lower back and radiates down the back of my left or right leg. Also in the affected leg, they may get numbness and or paresthesia, which, as we mentioned earlier, is that tingling down the leg. Now up here I've got a diagram of what's called dermatomes. So as you can see in the diagram, certain nerves innervate certain areas of the legs. So when testing sensation in the legs, the area that they describe the symptoms may help you narrow where the actual compression is happening. Now also on the examination, the main thing that helps confirm the diagnosis is what's called a straight leg raise test. So as you can see at the diagram up here, all you literally do is have them lie flat on the examination couch, and you're literally keeping their leg straight, just lift it straight up in the air, and if they get any pain at any point, that's counted as a positive test. Now another thing to note is the angle at when they start to get symptoms helps clarify what might be actually causing the pain. So for example, if they get pain in less than 30 degrees, then the causes of this could be spondylolisthesis, a gluteal abscess, disc protrusion, a buttock tumour, or acute dural inflammation. If they get symptoms between 30 to 70 degrees, then the commonest cause of that is a herniated disc, and if they get positive symptoms above 70 degrees, then the likely cause is tightness of the hamstrings, the gluteus maximus, or hip capsule, or there is an issue with the hip joint itself or the sacroiliac joints, which is where the hip joins the spine. Okay, so another thing to make you aware of is something called deep gluteal syndrome. So this is where the muscles of your lower back and around your hip compress the sciatic nerve. So this tends to present with buttock pain, that is worse with prolonged sitting, and there's also tenderness on palpation of the deep buttock muscles. So a test that you can do to confirm this is what's called the positive seated piriformis test. So this is where you have someone seated, you flex their hip, adduct it, so bring it inwards, and then you internally rotate the leg. So turn the knee inwards towards you. And if that causes pain, then that's classed as a positive test. Now moving on to red flag symptoms, which indicates a more serious cause of their pain and may need same day admission or urgent investigations doing. So first of all, symptoms suggestive of cauda equina, which is where the nerves of the lower back are completely cut off, as shown in the diagram. These include bilateral sciatica, so symptoms in both legs at the same time, severe or progressive bilateral neurological deficit, difficulty initiating urination or impaired sensation of flow, loss of sensation of rectal fullness, perianal or perineal or genital sensory loss or laxity of the anal sphincter, difficulty walking, or even erectile dysfunction can present like this. Features suggestive of a spinal fracture include sudden severe central spinal pain that's relieved by lying down, history of any trauma, especially for anyone who has a diagnosis of osteoporosis or is on long-term steroids, if you see any deformity of the spine, or if they have point tenderness over a vertebral body. Features suggestive of a cancer, if they have onset of symptoms under 18 or over 50, if there's a gradual onset of symptoms, if they have severe unremitting pain that even persists when they're lying flat, if the pain disturbs their sleep or is aggravated by straining or coughing or sneezing, if they have pain in the thoracic area, which is the mid-spine, if they have local spinal tenderness, if they have no improvement of symptoms after 4 to 6 weeks of treatment, if they have any weight loss, or if they have had a background of cancer in the past. Features suggestive of an infection causing their sciatica include unexplained fever, a recent history of TB or a urine infection, poor diabetes, history of intravenous drug use, untreated HIV, if patients are on medicines that cause immunosuppression, or they have any conditions that cause immunosuppression. Okay, so moving on to investigations. So for most people, sciatica is a clinical diagnosis, and you would only consider getting an MRI scan done if their symptoms are still persisting after 12 weeks. Now, even if referring a patient for an MRI scan, you need to make them aware that in about 49% of people, they can actually have a normal MRI scan. As mentioned earlier, their sciatica could be due to deep gluteal syndrome, which won't show up on MRI scan. So you've diagnosed sciatica, now on to the management. Most people will improve over time with exercise, manual therapy, and pain management. And you can reassure patients that the majority of them, their symptoms will settle within 4 to 6 weeks. You can apply heat to the area to try and help with healing, but if you do, please make sure you've got clothing on to the area that you're applying heat, or apply a towel or a cloth to the heat source, because if you just put it directly on the skin, can lead to a rash called erythema bigni, which looks like this. They can also try putting a cushion between their legs at night time when sleeping, so that can help relieve the pain at night time. And then next you'd move on to exercises. So again, I'll link down in the description. Versus Arthritis website has good back exercises to help, or if they're unable to access that, then you would refer them for some physiotherapy. And then next we move on to medicines to help with pain management. So first line is anti-inflammatory medications like ibuprofen or naproxen. Now if they're going to be on this long term, or they suffer from reflux, or have other medications that increase their risk of reflux or gastrointestinal bleeds, then it's recommended to put them on a proton pump inhibitor as well. If that doesn't help, then the next line would be to move on to weak opioids such as codeine or tramadol. And then if they haven't worked, the next step would be looking at the neuropathic meds which help calm down the nerves, such as amitriptyline, pregabalin, gabapentin or duloxetine. And if they've all failed, and depending on what the MRI scanner showed, you may then need to refer them on to a specialist, whether it be a spinal surgeon or the pain management team. Well, that's it for today's video. I hope you found it helpful and you've learned something new. As I've mentioned throughout the video, I'll link all the resources I've used down below, from the guidelines to e-learning to just some general resources to help patients. Don't forget to like, comment and subscribe so I know that you're enjoying this content. And if there are any topics you'd like me to cover in future, then please comment down below. I also do shorter videos on here as well, so have a thorough look through my YouTube channel for some more little comedy or educational videos. Or I also post stuff on TikTok and Instagram, which I've got all the details up here if you want to go and have a look. Or if you'd prefer, you can contact me via email, and my email address is just up here. Well, I hope you guys have an amazing week, and I will see you in the next video. Well, I hope you've enjoyed it, guys. There are some links up here to some playlists or another educational video if you want to learn some more. Or there's even a little subscribe button here that will take you to the main homepage as well, and you can check out all my other videos. Well guys, enjoy your week and I'll see you in the next video. Bye!